Thank you all for coming out tonight. We're super excited to have all of you future doctors here with us. My name is Dr. Nikirk, and I'm the director of the Student Ambassador Program at Harrison's Bird Foods. If you're interested in working for Harrison's as a student ambassador at your school, feel free to reach out. I'll put my email in the chat later. During the presentation, feel free to type questions in the chat at any time. At the end of the presentation, you'll have the opportunity to raise your hands for a live Q&A with the speaker. We'll be giving away a number of awesome gift cards today, selected from students who participate in the polls, the chat, the Q&A, so be sure to participate. It's my pleasure tonight to introduce to you Dr. Murphy. Dr. Murphy graduated from UF-CVM in 2014. After a year in exotic and small animal general practice, she completed an internship and residency at the Medical Center for Birds under the mentorship of Brian Spear, Brenna Fitzgerald, and Jeff Olson. She obtained board certification and a recognized specialty in avian practice by AVBP in 2019. At the culmination of her time at MCFB, she had been involved in the care of over 20,000 birds. From that point on, she's been collaborating with the AAV to create an avian curriculum available to veterinary students, is the director of clinical medicine at Moycor Reference Labs, who is best known for automating the avian CBC, and is the medical director for Harrison's Bird Foods. She continues her clinical practice in Southern California and is currently training her first resident. So without further ado, I'll hand the night off to Dr. Murphy.
Hey everybody, Kaitlyn, thank you so much. I'm so excited to be here and to talk to you guys about the avian physical exam. I was just saying, like, this is my absolute favorite topic to talk about because I think it's the most powerful thing that you can possibly know. Like, if you got this, you can figure out the rest of avian medicine. So I'm going to pull up this presentation and we're going to get going. All right. So first thing is, if you guys have any questions, if you can put them in the chat. Is that correct, Kaitlyn?
Yep, they can put them in the chat, or they can also hold the questions till the end.
Perfect. So either place works. And then there's going to be some different times throughout the presentation where you'll see that there'll be some questions that I have for you guys. If you want to participate, it would be awesome. Just put your answer in the chat, and then of course I'll let you know what the right answer is, and you can kind of test yourself and see where everybody else is at. So as far as like, hey, were we all thinking the same thing or not? So first off, I know we always say it's the physical exam, but I titled this the avian exam because really there are two parts to an examination, right? And so we're going to learn about those things and then go through some cases, and I think it's going to be excellent. I just want to take a shout out to Harrison's for sponsoring this, because not only do they make an awesome bird food product, but they also are very, very passionate about the health and wellness of all birds and also the education of veterinary students. So if it wasn't for them, we wouldn't be here, and I'm just stoked that they could help support us in doing this for you guys. I want to just briefly introduce the Harrisons because they really made a big difference in avian medicine in general. This is a picture of Dr. Harrison and his wife, Linda, and Greg has been practicing for over 40 years. He's double boarded both in Europe and in the US. And he was one of the founding members of the Association of Avian Veterinarians and the author of many textbooks, as you guys have probably already read some of them and seen them and whatnot. He is really one of the founders of avian medicine as we know it today. So he's been him and his family have been absolutely pivotal in this field. And not only that, but he also created Harrison's Bird Foods, right? And so it's pretty cool. The way it started is he realized that birds did not have the right type of balanced nutrition when he was in practice, and he was just seeing all of these different nutritionally based diseases. And he's going, my gosh, if only we had the right foundational diet, we could avoid so many different problems. And so he started doing all of this research and looking into, well, what do they do in Europe and what do they do here and what has worked in chickens and what has worked in other species and how can we bring this and make a parrot product. And ultimately, it was when they were able to take their product, feed it to a multitude of breeding birds, and see that not only did those birds flourish, but they were able to parent raise their chicks successfully. And when they applied it to the hyacinths, and you see the background of this slide, this is Dr. Harrison back in the day, and he's got these hyacinth macaw babies. And when he was able to get his hyacinth pairs to successfully parent raise and raise these healthy babies, he knew he was onto something. And so the diet has continued to evolve and improve over the years and really is an excellent nutritional option. It's the only organic non-GMO diet, parrot food out there. And so just something to have in the back of your head. I wanted you guys to understand a little bit more about who brought this to you. But now let's get into my favorite topic, the avian exam. So what we're going to do is we're going to talk about the visual examination and then the physical examination. Those two components are the two most important things that you're going to have to complete every time you see a bird in a room, right? Or in the zoo or wherever you are. They go hand in hand, and the information that you get from each of those different pieces is going to make you make a strong plan. It's going to make you confident in your recommendations and your therapeutic plans and everything. So then we're going to go through some cases, and then we'll answer some questions. All right, there we go. I already said it. It's the most powerful single thing you will do for all of your avian patients. And, you know, maybe you've been in externships, maybe you haven't. You're going to see a lot of different practice styles. But in my practice, I have never had a bird die in my hands. And I attribute it 100% to the visual exam. Many people will go and they will have this practice kind of flow where a technician will go into the room, they'll get the weight of the bird, they'll pick it up and they'll have it in their hands ready to go. You come in, you've heard the history delivered to you from the technician, the bird's already in their hands, you do your exam, you put it down, and then you have your conversation with the owner. It's not that that's bad, but you've missed 50% of the information that you need to learn about that patient because you haven't had the visual exam. So let's go through some of these different things, all right? So there's 4 components, and I keep them very simple. So the first thing you want to do is clarify the presenting concerns of the patient. You come into the room, the bird is either in the cage or on the perch or with the owner. Everything is relaxed, everything is calm. You sit down, you just have a combo. You say, hey, listen, what brought you in today, Mrs. Jones? What's going on with Spooky, right? Spooky comes in and she goes, well, you know, Spooky's a 30-year-old macaw. And he normally vocalizes every single day. He says hello to me in the morning. He says good night to me at night. And this is what we've done for 30 years. But the past 3 days, he hasn't said a word. And you go, wow, that's really interesting. Is there anything else you've seen? And she says, no, that's it. Now, what you may see is that Spooky has no feathers on his chest, kind of has an uneven, his wings are uneven, right? And you go, well, my gosh, if I just went in there and I looked at Spooky, I may think that his issue is his feather loss or his wings or whatever. But the most important thing to this client, what made her come into you, is that he didn't talk. And so making sure that you and the client are on the same page, what is concerning them? Why are they here? That is the best foundation. Now, while you're having this conversation, right, you can ask some other questions, get a little bit more details on some historical, larger subjects that were discussed. And at the same time, you're assessing the patient. Now, that bird is going to be sitting there, wherever it may be, on the owner, on the perch, and you go, you're talking to Mrs. Jones and you're saying, hey, listen, blah, 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 but you're also keeping a peripheral eye on this bird. And the reality is that birds, as a prey species, should have this massive adrenaline rush when they come to the hospital, and they should look the best they're ever going to look, right? That adrenaline is going, hey, look at how normal I am, no, regardless if they're sick or not. So if they look sick, if they're sitting there quiet in the corner, maybe they came in and they started talking a little bit, that adrenaline spike, right? And then you're talking to Mrs. Jones and you're not paying attention to them, you're not interacting with them, but you've got your peripheral on. And you see that they close their eyes, maybe get a little squinty, hunker down in the corner. Maybe they're quiet, they get fluffed, they lift a leg or they don't. All of these tiny little things, they're relevant. So this picture, this cockatiel picture, is really important because you can see that maybe this picture here on the lower left is how the bird looks when you come in. But then it looks like this in the upper left-hand corner as you're getting your history. Then it starts looking at you like this, like the lower middle, but then it starts to sleep again. Now you could be having your conversation and you can be recognizing these things and you go, you know what? Mrs. Jones is concerned about him not wanting to talk, but that's just what she could pick up on as, hey, I'm not feeling good. She's not picking up on these other things. And so you say, hey, you know what? Has Spooky been doing this at home? Maybe, sleeping more a little bit quieter. You point out to her what you're seeing in that moment. And she goes, huh, you know what? I haven't, but this is weird behavior for him here. All of a sudden, you're gaining this information and you're going, how's his mentation? It's a little bit quiet, maybe quiet, alert, and reactive. His behavior is more subdued than normal. Eyelid position, is he squinty and tired? Or is he bright-eyed and bushy-tailed, right? What's his posture like? Posture is something that's very important because when birds are uncomfortable, let's say when they're uncomfortable in their legs, they'll often put their beak down on the floor and they'll go in this tripod stance, right? It's almost like they use their head as a cane. So maybe they're standing up straight when you come in, but then they put their beak to the floor when they're at rest and you go, what's going on there? Last thing is respiration. Are they breathing heavier and faster than normal, right? Or is their respiration normal? So these things are really important because it leads directly into the next step. And that is, what is your plan? Are you going to pick up this bird to do a physical exam in its state? And if so, what are the potential risks? What are the potential issues that you could run into? So in Spooky's case, right, you see that he is breathing normally. He's just a little quiet in the corner. And you go, hey, Mrs. Jones, what I'd like to do is do a physical exam next. I'm concerned about how Spooky looks because he's lethargic. And for him to change his routine after 30 years, I'm taking that as something serious, right? I don't know what's doing it, but he's telling us there's something wrong. Ultimately, I think that capture and restraint in a towel is going to be safe for him so that we can get more information to build the next step of our plan. However, if I see that his respiratory rate starts going up, or if his mentation changes at all, I'm going to put him right down. We may have to move quickly to something else, but ultimately, I just want to make sure, that this is all okay. So you're thinking about this in your head, and then you're having this conversation with Mrs. Jones, right? And now what's going to happen because of this is you have understood the client's concerns. You've evaluated the patients for any issues that may arise during your physical exam. You've made a plan about how you're going to pick up this bird and if you're even going to choose to pick it up right now. And you've discussed those concerns with the client. This gives you such a strong foundation where now everybody's on the same page. They've accepted the risks and benefits, and the client feels heard. This is why I think I haven't had some of these negative side effects, because there are so many times where I walk into a room and I see a really, really debilitated patient. And I go, hey, listen, I'm going to do a very abbreviated exam. And I'm just going to have them sit in my lap while I do it. And we're not going to be able to learn everything from it, but we're going to get enough of an understanding to know what our next steps should be. Rather than, and I hope that immediately you can see how this environment can really help shape and connect you with the client and the patient in comparison to the technician comes in, the patient's in the hands already, and ultimately you've got this scenario where maybe that was a completely unstable patient and you never got to see it, and now, it hits the fan, and what now? So these 4 steps are absolutely awesome to do before you do your hands-on physical exam. So, okay, now we're going to go to the physical exam. And I know that was very brief, but the visual exam should only take 5 to 10 minutes of your appointment time. I encourage that appointment time should be somewhere between 25 to 30 minutes for birds, because often there's a lot more to discuss than what meets the eye. So 5 to 10 minutes to get that done would be very reasonable. If you find that you're in practice and you only have 20 minutes, well, then maybe it's something that you do your best to tailor to the 5-minute range, but it's so beneficial that it's absolutely worth it. So now you know what you're going to do. You've decided that you can pick this bird up and you can do a complete physical exam because you expect them to be relatively stable during that event. So with the physical exam, everybody says you got to look at the eyes and the ears and the this and the that, and it's cool. It's like, right? It's like you look at all these things and you say, yes, it's normal, or no, it's abnormal. But what does it actually mean, right? How do those findings help you formulate a plan to your next step? So that's what I want to try and convey in this next portion. I just love this. All right, so here are all the different things that I look at, right? And in a perfect world, I would look at every single one of these components. In every exam, you're not going to have the time or the ability to look at every single one. So how do you prioritize, right? Well, first of all, the most important thing that you can possibly pick up from your physical exam is the body condition, okay? And body condition in mammals versus birds is a little bit different, right? So we're going to go through that in detail first. So body condition is composed of 3 different components: the muscle condition, your observations of fat, and body weight, okay? So these 3 variables and the information you obtain from them are going to allow you to make an overall conclusion on if body condition is adequate or not. This picture of this budgie is very interesting. So I hope that you guys are looking at it and catching and picking up on a few abnormal things. The first thing that's important to see is that this coelom here is distended. It's big and very round, okay? And you could think about intracoelomic disease when you see this. But one of the most important visual things that you can see is that underneath the skin, there's this yellow kind of appearance. And this giant big thing that we're seeing here on this belly, this is a big fat pad. There's a whole bunch of fat. Now, the other thing that's very interesting in this budgie is that the upper beak is overgrown. Specifically, the anatomic name for this portion of the beak is the rhinothecal tomium, the rhinotheca being the keratin of the upper bill, and the tomium being this cutting edge, right? So really, it should be very short, but it's very much overgrown. So if you ever see a patient like this in your clinic, right, you go, whoa. Right off the bat, you go to find a muscle, you go to look at body condition, and you go, oh my gosh, this bird is very, very fat. If there's this much fat on the outside, there's going to be an equivalent amount of fat on the inside. Intracoelomic fat, although it's benign in nature, can be so voluminous that it can compress the air sacs and cause these guys to go into respiratory distress. We also know that it's going to deposit into the liver, possibly leading to a state of hepatic lipidosis or fatty liver disease. In this bird, just from this big old belly and that overgrown beak, one of your top differentials should be hepatic lipidosis, since the liver is responsible for keratin health, and we often see that in this disease state, you'll have overgrowth of that upper bill. When you have a fat bird, you never want to pull blood from it. So in this case, I would say, hey, you know what? I do a short exam. I say, listen, before anything happens, we need to get weight off this bird. We need to get him on a better based diet. And ultimately, anything else that's going on is not going to be able to be addressed because this state is causing so many issues that it's just too much. So let's do one thing at a time. Let's fix this abnormal body condition. It's going to make the beak go back to normal. You have to trim it the first time, but over time it will not regrow like this. And ultimately, you can make a big difference in this patient's life and bring him ultimately back to normal. Now, if the only thing you did in this bird was go to assess its body condition, and during your visual exam, you noticed that his beak was abnormal, you have super powerful information. So this is really cool. So first of all, so I like this picture a lot because it's a really great case example and it's a very clear example of fat. But let's talk about muscle condition because this is our first variable. So muscle condition is the evaluation of the pectoral musculature. You can see these are all, I'm sorry, there are going to be a lot of, not a lot, but a reasonable amount of dead bird pictures to show examples of different states here. So 1 out of 5, just as like, your Purina scores, the lower it is, the poorer the the poorer the muscle condition, the higher it is, the more adequate the muscle condition. Generally, for most species, a 3 out of 5 and higher is ideal. What you're looking for is how well developed the pectoral musculature is in comparison to the blade of the keel. So you can see in this 1 out of 5, the blade of the keel is very, very prominent, and there's hardly any musculature here at all. This is a very emaciated individual. 2 out of 5, see how there's like a little bit more here on the sides? 3 out of 5 is normal, and you should really feel this U-shaped contour, right? If you palpate the blade of the keel first, it should be a nice U on either side. 4 out of 5 and 5 out of 5. This Amazon was a really good flyer. You can see that there's no yellow discoloration that's indicative of, fat pads along the lateral flanks there. This is all just big muscle. Oh, excuse me. So one of the things that's important is that if you're dealing, let's say, with a laying hen, like a galliform, for instance, right? So your backyard chickens, your laying specific breeds, a 2 out of 5 is more normal for them, okay? Whereas for most parrot species, you're looking at a 3 out of 5 as normal. But if you're examining an African gray, they are the most well-muscled individuals. I look for those guys to have a 4 out of 5 or a 5 out of 5. If they are a 3 out of 5, I want to know why. Oh, one more thing on this slide is that when you evaluate the muscle condition, you can grade them, but what does it mean? If you have a sick bird and they have normal musculature, that means you're more likely to be dealing with an acute onset of disease, because disease is it's an energy expensive state, right? So ultimately, you're going to have disease present, but it's not going to rob the body of its energy and of its muscle, right? But if you have chronic disease, slow and steady worsening of a disease state, muscle is slowly going to go down. So if I'm seeing a bird that has a 1 out of 5 or 2 out of 5 situation, whatever they have going on has been going on for a while. If they are sick and they're a 3 out of 5 to a 5 out of 5, I go, okay, I'm going to rank acute onset disease higher on my differential list than the more chronic diseases because of this muscle condition. So you can see how, whoa, just from this one single physical exam finding, you already have a framework for your differentials. You don't know what diseases there are, but you know how to generally rank them right off the bat. Now, you don't want to tunnel vision because there could always be an acute on chronic disease process. So you have a bird who has a chronic issue that's managed, but then you have an acute one. So of course, there's always the gray area in between, but it's nice to just pause, make yourself a framework, and then accept that you're going to be fluctuating between the framework in real life. All right, so fat observation. You can have fat over the coelom as we saw in that first picture. The afterlay are the natural featherless regions of the bird's body. Every single species has them. And the most common one that you're going to interact with is the one on the right side of the neck where the jugular vein courses down the middle, because you'll be doing venipuncture in that region. A lot of birds will develop fat pads on that side when they're profoundly obese. And so if you go to look for that, that vein and you can't see it because it's all yellow, well, maybe that's not the right place to draw from, or maybe you should look for fat in other regions too, and pause and question, should I be drawing blood from this bird right now, or are there other things we should be doing first? Around the vent is a very important place to look as well. You can see it as vent on its little booty hole, okay? And you can see all of its fat here. Got that kind of yellow tint, and all of these little white things. This is all urate scalding. When this bird would perch, it was so obese that this fat pad here actually obscured the vent, and the bird presented for having issues like straining to pass droppings. Well, we learned real fast why. Over the crop is a very common area for budgies. So sometimes you'll think like, oh my gosh, this budgie had this big old crop, and then you'll look further and you'll be like, oh no, it's a big old fat pad, right? And then the lateral flanks is another place as well. You'll sometimes see it on the lower part. Now this is a African gray. It's very rare. They have to be really, really over conditioned, like a lot of high calorie food for them to get fat. So this was a really unique presentation, but you can see that yellow discoloration underneath the skin as well. So how do you figure out what's ideal? We talked about how there's species differences, but we also have to recognize that the pectoral musculature is involved in different activities that these birds may or may not do. So for a bird who is flighted, right? Let's say you have one of the birds that fly around at like Animal Kingdom and they're in the shows. I would expect those birds to be a 4 out of 5 or a 5 out of 5, no matter what species. However, if you're seeing, you know, Mrs. Smith's 50-year-old Amazon who hasn't flown in 30 years, well, maybe I would be okay with like a 2 out of 5 or 3 out of 5, as long as I knew that there weren't other things going on. What about birds who have sustained some trauma to their wings and they don't have normal range of motion? Their pecs are just not going to be worked out as much. And so in those cases, you may feel an asymmetry of pectoral musculature, which actually may be acceptable and normal for that specific individual. So again, a general framework, and you apply that to the individual to make your conclusion. Age is important as well, because if you think about a young bird, maybe for their first year of life, you really aren't going to feel a ton of pectoral muscle development because they maybe haven't flown a whole lot yet. You know, they got to lift weights for a while. So for my young kids, like less than 6 months of age, if they're doing great and they're somewhere between like a 2 or a 3 out of 5, I'm happy with that as long as I see them back in like 6-ish months and, you know, just re-examine them again, make sure that they're developing appropriately. So you make your assessments, you consider these variables, and then ultimately you make your conclusion. Is what I'm feeling and seeing appropriate for this individual based on all the things that I've just learned in this lecture? Okay, so the next thing that's important to do is listen, right? But there's a couple of areas that you want to listen that are different than mammals. The heart, when you listen to the heart, you're just going to hear this like rapid heartbeat. It's very rare that you'll hear clinically significant arrhythmia, and it's very rare that you'll hear a murmur. The absence of a murmur does not rule out cardiovascular disease. So we are trained to correlate the presence of a murmur with cardiovascular disease in mammals, period. With birds, that is not the case. So listening to the heart is interesting. And maybe the most important thing that I do is I go and I try to get a sense of how loud does the heart sound? And where that becomes relevant is depicted in the picture that I have on this slide. This is an echo of a bird. You have the skin of the abdomen that's here. Then the next thing you see is this is liver tissue surrounded by fluid. So this bird has ascites. And then you have this other ball of tissue or ball of fluid. This is fluid. This is the heart. So in this patient, you have pericardial effusion. And one of the things that you'll start to pick up on as you see more cases of birds in heart failure is that when they're in heart failure, their heart will sound quieter. And it's very subjective. But the first time you hear it, you're going to go, oh, and then you'll never miss it again. Now, it gives you a clue. It doesn't confirm, but it's enough for me to say, hey, you know what? Let's just get a quick echo. Let's just put a probe on this bird and see what we see and go from there. And this, you guys can get this. You can totally see if a bird has pericardial effusion. Lungs are very interesting. Most of the time, you hear nothing, and that is normal. Because of the way air flows through the bird's lungs and their air sacs, it's very, very rare to hear the normal inspiration and expiration sounds. If you hear anything at all, and that bird has any observable respiratory abnormalities, or the owner is seeing things at home, take an X-ray. The one time I did that, I felt like I was saying, gosh, is this young golden conure, 8 months old. This bird came in and the owner was like, you know, I got him and I've had golden conures for years and he just seems a little bit off. I can't put my finger on it. So he had great muscle mass. He was sweet. He was bright and alert in the exam room. And I listened to him and I told the owner, you know, I hear lung sounds. I hear respiratory sounds. And that's weird. I usually hear nothing. Let's just take an X-ray. When we take an X-ray, it turns out this bird had early onset atherosclerosis, not atherosclerosis, excuse me, aspergillosis. So we took this X-ray and you could see these little, very slight patchy areas of soft tissue opacity within the air sacs and a couple patchy areas along the pulmonary tissue. And we said, ooh. So then we scoped him. We found these areas while we were doing the endoscopy, splashed some amphotericin B on them. Well, first we got a culture. Okay, got a sample. Then we splashed some ampho B on them. And of course, we then were able to confirm our diagnosis of aspergillosis, and this bird did great. So those little subtle things that you find on your exam, take them seriously. It's going to improve your overall patient care. And what's the worst thing that happens? You took it a little bit too seriously and you take a pair of x-rays and it looks okay. That's fine. But I remember telling this owner, I go, you know, I don't know if I'm overcalling this or not. Do you want to just wait and see? Or do you want to take these rads? I go, I'm leaning, I wouldn't bring it up if I didn't think that you needed it. And she goes, no, I'd rather play it on the safe side. And sure enough, it made a huge difference for this patient. And so these are the types of things that are important to communicate with owners, and ultimately something that you should feel confident in. If you hear something, say it, you know? Now, the lungs you listen to over the back, and then if you go kind of between the wings is usually where I go. And if you go a little bit lower, you're going to listen over the caudal thoracic air sacs, kind of early abdominal air sac region. And it's nice to kind of just see how air flows through there. Finally, the ventriculus is another region where you want to listen. And ultimately, the ventriculus is always going to be in the same place, right? It's going to be tucked up just underneath the rib cage. And when you put your stethoscope on that area, you should hear maybe 2 or 3 times within a minute this sound where it's like somebody taking a pair of boots and taking a slow step on a bed of gravel. And what that is it's a ventricular contraction, right? Now that's really important in your chickens, your ducks, your geese, your galliforms, your antheriforms, those larger things. I don't do it as much in parrots, although sometimes I have. It just depends on how the animal's doing and what I'm worried about, that sort of thing. But definitely feel for that ventriculus in your chickens and your ducks and all of those similar birds. Put your stethoscope there. Listen to what you should listen to and note what you hear. You should have 2 to 3 ventricular contractions per minute. And if you don't, something's going on in there. Okay. Now, ultimately, another way you can look at that is you can say, well, within 30 minutes, this chicken or this bird should have pooped in this room multiple times. And if they haven't, well, then that's a problem, right? So, okay, let's move on. Palpation. Now, this is a necropsy photo, clearly. The head is at the top of the screen. The bird's left is on our right, and vice versa on the other side. So this would be equivalent as if you were reading a radiograph. As you can see, the keel and the rib cage have been reflected up. And there are a couple of key things that I want you to know. Of course, the heart is up top and then the lungs are to the side. You have the liver, and in this bird, the liver is quite abnormal. The liver is here, and the blade of the keel is going to end like right around this area. So you may not feel the liver in this case. But what I want to try and communicate with this picture is, what are you going to feel when you feel the coelom? Okay, when you go to do your coelomic palpation, what can you actually learn from this? So of course you want to evaluate, is the coelom distended or not? Okay, a normal coelom should be concave, right? It shouldn't be even and it shouldn't be convex. So if you feel any of those things, it's significant. The position in which you feel this is very important. So if you have the bird and it's held up like this, subtle coelomic distension may not be caught because gravity is pushing things down. So sometimes when I'm a little bit curious, I'll have the bird standing in my lap and I'll feel the contour of the belly that way. And ultimately, it helps me understand more about, is there a little bit more going on here than there should be? But in the upper left-hand corner, you're going to feel this egg-like structure, and that's the ventriculus. Don't get fooled that it's an actual egg. It's a normal part of anatomy. And then after that, it should be emptiness. There shouldn't really be a whole lot that you can physically feel. And then that's considered normal. Just for kicks, I did this other thing, and I hope you guys are recognizing that this bird is very fat. You can see all of this subcutaneous adipose all along the lateral flanks here, okay? And even in this inguinal area, you can even see it around the heart and in some of this connective tissue. Now, here is what exists when you take the heart out and all of the GI tract out, right? So you can see the lungs are still here. But then you see here's the little testes in this bird. Here's the cranial pole of the kidney. This is the left and the right. Excuse me, the left. I got that backwards, but left here, right here. The remainder of the middle and caudal poles are sat further down. You can actually see the ischiatic nerve right here, which is really, really cool. The ischiatic nerve is the equivalent of the sciatic nerve. And it's one of the things that can cause lameness in birds when compressed. So, one of the classic things is you've got the budgie that can't use its leg, and it's because it has a testicular tumor. Well, anatomically, you can see how if this testicle was super big, right, it would put pressure on this kidney, and it would subsequently put pressure on this nerve, innervating the rest of the leg muscle or pelvic limb muscle. The same thing goes if you have renal enlargement. But what if you don't have enlargement of any of these things, but you have enlargement of the GI tract or the oviduct? The oviduct lies right here. The GI tract lies on top of all of this. So it's just really important to understand how all of this anatomy sits on top of each other and how it could contribute to the clinical signs that you may be seeing. I just keep pointing out this fact because it's so clinically relevant. This bird had severe hepatic lipidosis. Now, again, I'm sorry, this is a very gruesome picture. It looks like it's straight from Dexter or something. But here is the GI tract taken out. And you've got the duodenum here, the pancreas lying between it. The colon is this loop here. You've got your connective tissue and it's all filled with fat. This is the spleen, which is kind of a cool thing to see. This is normal in this bird. And then ultimately there's just some more jejunum over here. Now, the next thing we want to look at is feet. The plantar aspects of the feet are like so informative. This is a patient, her name's Boo Boo. Boo Boo had really bad arthritis. And when she presented to me, what she had was more wear on the right foot than the left. Now you can see here, this little red region. You can see some wear here. You can see it here. Even maybe a little bit right here. Now this is much improved from when she presented, but ultimately it's asymmetric. And what this means is that Boo has been putting more weight on her right leg for a long time. And as a result, she's gaining these pressure sores. So for her, it was important to notice this because the owner thought she had something wrong with her toe. I said, I don't think it's wrong with her toe. I'm concerned she may have arthritis because of this abnormal wear pattern. Also, you can have these patterns because of other things going on in the belly. Now here, her belly wasn't distended. She had great muscle mass. So I wasn't as concerned about that. Arthritis was at the top of my differential list and intracelular disease was more at the bottom. But an x-ray for her was very informative and told us that she had pronounced arthritis in her left leg, not so bad in her right. And that's why she was trying to not weight bear in this left leg. So just alone, these things are a big deal. Now, it also can tell you about husbandry, right? So if you had symmetric wear patterns that were inappropriate, because really you shouldn't see any of these wear spots at all. If they were symmetric, it could tell you, well, if they're older, maybe we consider arthritis, but ultimately, what about the perch size? We know that the perch that the bird sits on most of the time their feet should wrap 75% of the way around that perch. And so that's how you can determine if it's the right diameter. Also, you want to inquire into, well, is it a rope perch? Is it a very abrasive perch? Is it a concrete one, a sandpaper one? And what can happen is birds will decide where they want to sit in the cage, and they don't care what the perch is like. So they will choose their location in the cage over the feeling of the perch. So getting into some of those questions based on what you're seeing. Is there an abnormal wear surface? Is it unilateral? Is it bilateral? And how can that influence our plan to either take radiographs or inquire about husbandry, right? The other thing you want to look at in the feet is the joints. So I'm not sure if you guys have seen any of these cases yet, but this is an example of articular gout. We know that's the case because you see these white plaque-like lesions here in what technically should be an articular space. In this bird, it was a little bit hard to tell because sometimes these cockatiels and smaller birds, their ligaments can be visualized and they're a white color as well. So the best thing that you can do is just put a drop of rubbing alcohol onto this tissue. And if it blanches white, like you see here, this is a picture after rubbing alcohol was applied, you've got articular gout. In this case, you want to pull some blood work, see what's going on, get them on good pain meds, and then kind of progress through the case going forward from there. But ultimately, it's very important to keep an eye out for this. Articular gout doesn't have to only occur in the feet. It can also occur in the elbows, in the spine, really anywhere there's a joint space. So if you are suspicious, maybe when you're looking at the wings, put a little drop of alcohol on it and then say, hey, you know what? I'm seeing something here. Let's look in these other places. but I always like to, the feet are always a pretty reliable place to catch this. Looking at the oral cavity can be quite difficult. If the bird allows it, sometimes, they go, oh, I want to try and like get the towel or get you, and you can get a quick peek up into the oral cavity. In this bird, you can see that it's nice and clear up here. You can look at the choana, and you're kind of visualizing the space behind it. The material, the tissue is appropriately reddened. It shouldn't be too red, but it shouldn't be too pale, right? You've got these nice pronounced, and you can tell this picture is from a couple of years ago, huh? But you've got nice, sharp choanal papillae. What's abnormal in this picture is this abnormality here on the tongue, right? You've got the scab in the tongue, kind of in the oral cavity. I know it's blurry, but I hope that you guys can appreciate that it's there. So your two main things when you look in the mouth on your initial physical exam is, what does the choana look like? Is there anything in there? And is there any debris in or within on the tongue or within the oral cavity? This patient here had a squamous cell carcinoma causing this buildup of like scab-like tissue. And ultimately, we were able to do some debridement of the area, and it kind of kept things at bay. So there's a lot of other options for this. You can do cryotherapy and blah, 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 but ultimately that's like a whole lecture in itself. So what you want to look for is well depicted in this picture. Range of motion. This is Momo. Momo's pretty cool. He was my colleague's African gray, and he's just a sweet patient, a sweet bird. But when you look at range of motion, there are two main things you want to look for. In the wings, do they equally extend, or and during extension, is there any pain or discomfort? With the limbs, you want to see that you can kind of pull them down as far as, all the way down and extend the limbs. A lot of birds, when they're uncomfortable, normally they should just let you, right? But if they fight you to do it, there's something that they're hiding there. Unlike maybe dogs and cats, right? Where they can like tense so hard that you can't really, you're like, are you fighting me? Or are you just being like a super strong dog, right? In birds, if they're fighting you and you have to put any sort of force onto, extending their limbs, it's more likely to be clinically significant. Okay, so here's our first question. This was a Pekin duck patient of mine. I want you guys to take a good look at this, and then I'm curious to know, do you think that this bird has a problem with its wings or with its legs? So I'm going to open up the chat, and I'm going to kind of watch what you guys say. Oh my God, I love all of you so much. Heck yeah, this is huge. I'm Italian, so we got to do the kisses. I love it. So, okay, most of y'all are saying legs, and I think that you're spot on there. Now, you can see this big old joint and this big old swelling. So if you clued in on that, you knew right away what the problem was. But one of the things I wanted you guys to catch on is that this bird started by presenting with a clinical complaint of his wings are broken. But really what he was doing is using his wings as crutches because his legs were uncomfortable. And this is a very common thing you'll see in ducks and geese, and chickens. They will compensate this way. Whereas with parrots, what they're going to do is they're going to compensate by tripoding, using their beak down to the ground and walking that way. So very good. Wonderful, you passed DVM. Now, the next thing you want to look at is the eyes. Really, with the eyes, nothing too crazy here, okay? You can use the ophthalmoscope to look towards the back of the posterior chamber. You can look for that black kind of squiggly thing that, of course, now that I'm sitting here talking with you guys, I can't remember the name. It'll come to me at the wrong point in this presentation. But ultimately, if you suspect head trauma, that's a really nice place to look, because sometimes you can have some bleeding within that posterior chamber and whatnot. But a lot of times with head trauma, I see hyphema and bleeding in the anterior chamber, and then you can't see anything back there. And so ultimately, visual examination of the eye is what is often done the most. Here you can see that there is a cataract within the lens of this bird. And then you can see the clear lens in this other one. Now, looking at the globe is only part of the eye exam. And the other thing is you want to look at the conjunctiva. So in this pigeon, you can see that there is a lot of inflammation of the periorbital tissue. Oops, excuse me. You can even see some granulomatous tissue coming from the nasal canthus. And you can see that there's also subophthalmos. And you go, well, is the globe actually being proptosed a little bit? Or is there just so much swelling around here? Now, for this bird in the upper left-hand corner with the cataract is a very, very old bird, started developing these cataracts, probably when it was around 25, 26 when it presented. And it still was visual. It was fine. It was a slow onset, although you can have acute onset cataracts. In birds, it's 100% associated with aging changes. There's no correlation with diabetic states or anything like that, like we see in mammals. And so I think that's an important thing to recognize. When you do see these changes, we know that they are not as visual as they used to be. And so working with the owners to provide things like environment changes, making sure they can get to their food and water, or whatever it may be, is very important. For this little dove, what we found is that she had a dacrocystitis, specifically caused by Pseudomonas. And so that was very, very challenging to treat. She wound up having some chronic issues with that over time, but ultimately she led a very good life for the time that I was caring for her. I'm not sure how she's doing now, but ultimately they have this, like these little openings right in this area, and that's where this discharge was coming out of. So the uropygial gland is important to recognize and to look at, and sometimes it can be quite challenging to find. It's right at the base of the tail feathers. So if you find the tail feathers and you lift the covert feathers or contour feathers up off them, then you'll find the tissue. And what it is this like unique looking feather. Oops, excuse me. And you've got kind of this heart-shaped gland associated with it. Now, things can go very wrong with this gland. You can get infections, you can get cancer. Carcinomas are very commonplace, and often they present like you see in these pictures up top here. And so it's something that you always want to look for, because it will go clinically. No one will know what's going on until it starts to bleed. So, okay, so here's another question. We'll go into the chat really quick. What parrot species does not have a preen gland? And the people who are saying the emu, you're 100% right. The ostrich, you're right. Yep. But specifically parrot species. Oh, y'all are really smart. This is awesome. Yeah. So for the folks that are saying Amazon parrot, you're 100% right. So when I was in my internship, I got, well, no, it was my externship. So it was at Medical Center for Birds while I was in vet school. I was there for a month, and I got asked all sorts of silly questions. And one was, hey, can you go pick up that Amazon and take a look at its preen gland? I forgot. I didn't know that at the time that they didn't have preen glands. And so that was a funny joke. But ultimately, it's something that you want to be cognizant of to examine in the species that do have it. So looking at the feathers and at the skin are important. You're going to see a wide variety of feather abnormalities, the most common being feather destructive behavior, which is what you would use to describe the general appearance of this moluccan here. This bird had a very severe automutilatory wound of its right wing, kind of on the inside, the ventral surface of that wing. You can't see it in this picture, but that is why this collar is on. This was a very challenging case because that wound was so deep and the tissue was messed with so much that the new feathers growing in were creating these cysts, these feather cysts. But the cystic material was comprised of an E. coli infection. And that E. coli infection was multi-drug resistant. And so there's a lot of debridement, allowing it to heal by secondary intention. This bird ultimately wound up doing really, really well, and never grew any of his other feathers back, but that's okay. He doesn't have to wear a shirt or pants. He can do anything he wants as long as he has a good life, right? So, you know, the assessment of the feathers and skin can literally be an entire month's course. Okay, so we're not going to go into it too far in this lecture, but ultimately, it's something that you want to note. One important thing. Okay, so we are going to talk about this just a minute. For birds who are chronically destroying their feathers at whatever level of severity, right? You handle their cases as needed. But let's talk about the older bird that starts to pick its feathers here over the center of its chest. Or you start to see feather abnormalities along the distal parts of the wings, where new feathers coming in look dystrophic or abnormal. The owner may tell you, I don't see him pulling his feathers out. I don't see him damaging his feathers there. This is just how they're growing in. In some species of birds, certain individuals will participate in feather destructive behavior due to pain or discomfort or underlying issues. And sometimes it's because of cardiovascular disease. So I've had some birds in heart failure, they start, like when their heart failure is uncontrolled, they start pulling their feathers out over their chest. With very, very bad atherosclerosis, sometimes the blood supply to those distal feathers is poor enough where, oh, my dogs may bark, excuse me, but the blood supply to those distal feathers is so poor that they come in dystrophic. So you look at this and you go, you really want to pay attention and use all of the other information you have about the patient and interpret that feather finding in context. Now, the beak again could be a whole lecture in itself, but when I look at the beak, I look for a couple of key things. I look to see that the movement of the upper bill is normal, the movement of the lower bill is normal, and you can see they move in all different directions. And I also look to see, is there appropriate occlusion? There is never a circumstance where you have to just do a healthy bird beak trim. Birds should take care of their beaks on their own if given the right environment and the right enrichment in their cage, and if they're feeling well. So let's say, for instance, I like to compare this to a hairbrush. So when you're feeling like crap, you wake up in the morning and you go, you know what? I don't want to brush my hair. I feel awful. I'm just going to put it up in a ponytail, or I'm just going to leave it, right? Same thing with birds. They don't want to groom when they're feeling poorly either. Now, let's say, for instance, you're a curly-haired friend, and I have curly hair, even though you can't tell right now, or maybe you can. But if you use the wrong brush for curly hair, it's a disaster. And I say that with passion because I've been there on accident. And ultimately, the same thing goes for our parrot species. If you don't have the right types of enrichment, the right types of toys for them to chew into, I mean, you're not going to put a piece of plywood in a budgie's cage and expect them to chew into that to groom their beak, right? So depending on what you see, if somebody comes to you and says, hey, my bird's doing great, I think it just needs a little cleanup, instead of you doing the cleanup, talk to the owner and say, hey, what are you offering in the cage that he can chew on? And let's adjust it. Let's try some new things and let's see what he can do on his own. Because if he's choosing to not groom his beak on his own, well then, hey, there may be more to the story and I'd actually like to do a complete physical exam. And that's a really, again, a really powerful way to engage with your owners, to empower them, and also to catch birds who may be showing slight clinical signs that other people may catch. Hold on one moment. Okay, so we'll move on, and we're almost to cases. So here's skin that's abnormal. This bird, you can see the flakiness. This bird had a Malassezia infection. So I saw this and I go, your bird smells like a dog ear. So we took a piece of tape and we did a little tape prep, and sure enough, there's a ton of budding yeast. So we used a short course of ketoconazole and it cleared right up. It turns out that this bird was offered some pieces of wood from the owner's just garden outside. They had done some preening in the garden and whatever and put it in there, and some of the sap had irritated it and it causes this infection. So birds get yeast infections too, and if you see this and you smell it, check and see what you got going on. So neurologic exam is really interesting. One of the things that you want to look at is, coordination, mentation. Are there any intention tremors? And let's see, this video is not loading, so I'll show you guys at the end. But it's a bird that has intention tremors. So it's shaking, you see its whole body shaking. Ultimately, these tremors, of course, could be to head trauma, it could be to brain tumor, but the other differential that we have to consider at all times is avian ganglioneuritis. You may have heard of this as referred to as PDD, proventricular dilatation disease. But ultimately, PDD is a misnomer because it infers that it only occurs in the crop, or excuse me, not even the crop, in the proventriculus. And the reality is it can occur anywhere in the body, including the brain, the adrenals, the epicardium, all sorts of places. So things to watch out for. Oh, sorry about the about the volume here, but do the birds have use of their limbs, right? So this is an egg-laying cockatiel who presented for the inability to move. When we took x-rays of her, she had a poorly shelled egg, and she was completely unable to use her pelvic limbs. They were limp, they were fully paralyzed. On her x-rays, we identified that she had a spinal fracture. And what can happen is in these egg-laying females that are on an unbalanced diet, they chronically lay. And what happens is every time a bird is stimulated to create an egg, osteoclastic activity is stimulated within the marrow cavity of the bones. It pulls calcium from those bones, puts it into the bloodstream, and that's what's used to make the egg. So if you have no calcium coming in and you have excessive calcium needs, your bones are just going to turn into nothing. And so when we see these guys, we call them glass birds. You have to be very, very careful. And this is something too, if you're taking a history with an owner and they're like, yeah, I just chronic, and you go, yeah, this bird's laying eggs too much. This bird's is a chronic egg layer. Oh, by the way, it's on a seed-based diet, and you see a sprig of millet the size of your foot in the cage. Be very careful when handling that bird. And if you are taking x-rays, it would be prudent to sedate that bird so that they're not fighting against any restraint. And these guys, this one had already broken her back just from the egg-laying event that she had experienced at home prior to this new egg forming. But ultimately, these are the types of birds who may be more prone to breaking their wings or their legs during restraint for an x-ray. Let's see, here we go. Ears exist, okay? It's very rare that you'll see an issue with them. Classically in owls that have sustained head trauma or birds of prey that have sustained head trauma, you may get some bleeding into the ears. But I have yet to see any issues in parrots specifically. It's not to say it can't happen, it's just quite rare. One of the things that's really cool though during a physical exam or an annual exam is if the bird looks pretty healthy, I'll just start showing the owner all the cool stuff about them. So I'll show them their ears, I'll have them feel their muscle mass, and I go, hey, this is normal. Feel this every so often if your bird lets you. Because if you feel a change, I want you to call me and tell me about it. And they're like, oh, cool, this is awesome. And so they're like, you've empowered them, they find value in that interaction in that exam. They're going to come back to you in the next year and say, hey, doc, what can you teach me this time? Is there anything new? Because I really liked what I learned last time. Ears is one of those things. Okay, so what are our goals with our examination outside? Our goal is to maintain healthy birds. But underneath that, how do we maintain healthy birds? We empower owners and we perform examinations. Owners, what they can do to help us is they can help with nutrition. They can help make sure that their bird's nutrition is balanced. You can teach them about it. You can teach them about proper husbandry and enrichment. There's always, always room for improvement. So the bird who's you've introduced to foraging on their annual exam, well, shoot. The next time, let's do target training. Let's advance our foraging opportunities. And now you've got this owner that you've made a part of your examinations. They know how to feel muscle mass and it's going to call you if they feel a change. They know how to provide proper husbandry. They know how to train their bird. They know how to do all these things. They know how to offer appropriate nutrition. That's insane. That's super cool. That's the top echelon, okay? For us, getting examinations done and tracking their overall health is the other component to this. Our visual exams are powerful, and also the bond that you form with your patients is powerful. There's so many birds that I would see over the years. I was at Medical Center for Birds, and you get to know them. Oh, I didn't put my explanation in there, but ultimately you get to know them. And I remember there was a bird that would board every so often, and it came in for boarding, and I'd go in just because I like to play with the boarding birds, and I'd say hello, and something was wrong. And I noticed it, and I told my colleagues, I was like, gosh, this bird's not right. I know this bird. This is not the normal interaction that we have. Turns out the bird ate a zipper and was dealing with zinc toxicity. So we got the zipper out, we got better, life was good, but the owner dropped it off not thinking anything was wrong. So knowing your patients when you have the opportunity to is very, very powerful. All right, so we're gonna do some cases. I hope you guys are doing well. This is our first one, so we have two cases, and then we're gonna be done, okay? So our first patient is a very young budgie. The history we have is that she's recently obtained from PetSmart, seems kind of tired. It's his owner's first bird. It's on a seed diet, and per the owner's observations, its appetite is all over the place. So we're referring to that as dyslexia. The owner just noticed this a couple days ago, but this is the bird that's in front of you. And I'm having this picture on every slide because I want you to literally just sear this image into your brain, okay? So our friend's name is Pat, and she is a female. On your exam, you pick this bird up, and you immediately recognize 2 out of 5. That's the only thing that you could do because Pat Bay regurgitates, swallows it, becomes super tachypnic, and you put her right back down, okay? And maybe even in this picture, you can see that the keel is more prominent just by this picture here. Now, another thing that you can see on the exam just visually is all of this stuff that's sticking in the feathers. Well, maybe if you've seen a lot of these cases, you would pick up on this before your exam. But if you are new to this case, what you can do is you can say, well, gosh, this bird just regurgitated a lot, flung it everywhere, and then choked on it. This is all regurgitation. This is all food material that's stuck in the feathers from regurgitation for who knows how long. But that is something that's been going on for longer than just that instant in the exam room, okay? So you're like, whoa, I got a super nothing physical exam on this bird. It's very sick. It's been going on for a while because even for a young budgie, this 2 out of 5, that's not right. This is too thin. And it's 27 grams. This bird should be closer to about 29 to 30 grams. All right. So what's your problem list? Regurgitation, you're underweight, chronic dyslexia, okay, because we know there's a low muscle mass, lethargy, and okay, we got to put it on there, but it's not, of course, our top problem, an unbalanced diet. So what are your differentials? And I think that this is probably the most fear-invoking question that anyone could ask you for the first, maybe 2 years out of school. And of course, like right when you're getting into clinics. So one of the things that I did to try and make it less intense and go immediately down the whole damn it scheme and all those sorts of things is I go, okay, let's pause and let's think broadly. What organ is failing? What organ system is affected right now? And in this case, I said, you know, I think it's the GI tract, right? So then now you can say, okay, well, what are all of your differentials from there? And it makes it a lot more digestible. Okay, so you've got your primary and you've got your secondary issues, right? In a young budgie with regurgitation, weight loss, and these clinical signs, macrorhabdus is going to be your first differential, followed by spironucleus, giardiasis, and then you've got your other things such as your crop infections, bacterial, fungal, and uveitis, dietary indiscretion, right? They're young, they're going to eat things they're not supposed to, and then heavy metal toxicosis, whether it's zinc or lead or anything else, you have to have that on there. Now, the things that are going to secondarily cause these clinical signs that we're seeing and affect the GI tract is dehydration, pain, and then of course, like any other disease process, but we're not going to go through them because let's just start here for a moment, okay? We will get to this if and when we need to. All right, so next question, and we'll put it in the chat. I'm interested to see what you think. So what do you want to do? Do you want to cry? Because that's usually what I would do. Do you want to go all in? CBC, Chem, EPH, RADS, crop culture, the whole thing? Or do you want to do option 3? And you guys can just do like 1, 2, 3. Start with some least invasive diagnostics and go from there. Oh, I love you guys so much. First one and then 3. Oh, okay, that's me. And 100%, I see somebody wrote like, due to the stress the bird is under, and like, yes, the patient is too distressed. Yes, yes, yes. 3 and 1. I love it. Okay. So you guys are right on the right track. The best thing to do for this patient is to start with option 3. What is your least invasive diagnostic that can help you rule in and rule out your differentials? I'm not saying that option 2 doesn't contain diagnostic tests that are invaluable, but the value of those tests is in a vacuum. If we take the blinders off and we look at the entire clinical picture, right? We couldn't even hold this bird, okay? Couldn't even hold it to do a full exam. So drawing this much blood, like CBC Chem EPH is a bunch of blood, probably more blood than this bird has. So there's risks involved in that, but also trying to do all of these things with the fact that we couldn't even do an exam would be risky as well. So although there may be value in them, the timing of them is very important. So when we look at option 3, what are we going to do? Well, cool. Fecal wet mount in-house. It can help us determine, are we dealing with any of these top 3 differentials? And then secondarily, regardless of what's going on, we can give them some fluids, we can give them some pain meds. This is not going to cause any problems. It's not going to affect our diagnostics. And ultimately, it's going to make them feel better, but no matter what's going on. So we do our fecal wet mount. And I don't know if you guys have had experience with this or not, but all you do is you take a glass slide, you take a little bit of poo, you get 0.1 mLs of 0.9% saline, you do a couple drops of that, and you put a cover slip over it. You want to assess the slide immediately. You view it at 40x, and this is important, and you adjust the condenser so it's down. You want to look for 2 things, and I think about them separately when I look in the microscope. I first focus on any moving structures, and I look in the background, okay? Because we're at 40x, we're not higher than that. And so, you know, things like GRDR you're just going to be able to see their movement. Do you see the falling leaf that Giardia is going to present with? Do you see these small, super quickly vibrating organisms that may be more consistent with spironucleus. Or, so those are your modal structures that you're going to look for. And then you're going to close your eyes, you're going to open them again and look into the microscope and say, okay, now I want to look for macrorhabdis organisms. These are giant rods. And you're like, you almost look at this and you say, it looks like I'm looking at a rod at 100x, but I'm at 40x, so I know they're even higher. And that's when you know you're dealing with macrorhabdis organisms. And you can see these two organisms circled in green. And this is it. We have our diagnosis. We have a patient who is dealing with macrorhabdosis. So this is huge, okay? Now, the treatment for this is amphotericin B, 100 mg per kg POBID at 30 days. There's some different durations. Some people will say 20 days, some will say 24. I just go for 30 days, and it seems to do the trick. I'll recheck at 30 days, and if organisms are still present, then I'll add a nystatin for 14 days and go from there. Most of the time, these birds will clear this issue. Now, oh, sorry, I have a shepherd and she just wanted to say hi. But some birds are chronically infected. Those are the lower portion of the population. But for the most part, young budgies, cockatiels, birds less than 120-ish grams who have this are going to get better from it. Birds who are bigger, like you could do a PCR for macrorhabdis and probably find it in other species, but it doesn't appear to cause clinical signs. So birds less than about 150 grams, it often causes clinical signs. And if you have a young budgie or cockatiel that looks like it's been regurgitating everywhere, fecal wet mouth, okay? Like just do it. Now, the tricky part is that if I saw this budgie, but it had none of these organisms on it, right, in its fecal, the next step I would do is I would send out a PCR, because even in the presence of disease, this organism is intermittently shed. And so, because what happens is they're embedded in the proventriculus, and so, you know, it's not like they're like right there in the cloaca or something. So it just has to come out with the digesta, and doesn't always. So this bird was very unstable. And despite having this diagnosis, we did hospitalize him, get him some injectable meds, start him on his amphotericin, make sure he started eating, and then was able to be discharged the next day when we saw that he had responded well to all of those things. If he was a little bit more stable, I didn't have this diagnostic finding, and I was sending out a PCR, I would send him with maybe some pain meds and talk with the owner about, well, do we want to just start some AmphoB just in case? You know, that's a conversation you have with the owner, but ultimately, this is a very, 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 very common disease process that you're going to see in young budgies and cockatiels. And so I'm searing it into your brain, and hopefully you always remember it, and it helps you in practice. Now, if you find this in older birds, sometimes this can be a secondary disease process. So in an older bird, I would stabilize them in hospital, and I would absolutely pursue radiographs in addition to this this fecal wet mount or PCR, because there tends to be a higher prevalence of GI tract neoplasia in these older budgies and cockatiels. And so if you've got these, you know, if you've got this in an older bird, you kind of want to know a little bit more about what's going on with that one. All right. So here's another question. I want to know if you know how old this bird is. And the two options are less than 6 months old or greater than 6 months old. Oh my God, I love you guys. Okay, this is amazing. I love it, love it, love it, love it, love it. So yes, 100% less than 6 months old. And the dead giveaway is that these horizontal feather bars on the top of the head still exist. Once they're greater than 6 months old, you'll notice that these horizontal bars will fade, and they'll start like maybe a third of the way back on the head instead. So pretty cool. You know, you'll get the young birds that people get from PetSmart, and they'll say, oh yeah, it's a 1-year-old bird, but they'll look like this, and you go, well, I know it's not because XYZ. And then they'll say, well, is it a male or a female? Oh, okay. So now that we know that this bird is less than 6 months old, okay, is it a male or a female? Is it male? Is it female? Or can we not say? Those are your three options: male, female, or we can't say. Yeah, super cool. Okay, so 100% the folks who are saying, the folks that are saying female, I'm sure you're cluing into the pink seer. However, we can't be confident in their sex just based on seer color until they're a little bit older, closer like to 8 months to a year. So that's something that you'll also be able to educate owners about. And also, I got totally fooled with this. Oh my gosh, my talkative dog. I got totally fooled with this. Some of the different color mutations, like the blue and white mutation, their seer color will be switched. Pink will be a boy, blue will be a girl, and it's just kind of intermittently done. So, and I learned this because I thought this bird was a female forever, and then she ultimately passed away. We did a necropsy, and there were two testes in there. And she had a big old pink seer. The testes were normal. It was a blue and white. So, anyway, with that being said, you guys did great. That's always one of my favorite questions to ask. All right, so this one's the last case. You guys are doing great. This is Booker. Booker is an elderly but unknown age, unknown sex, double yellow-headed Amazon, okay? And this is Booker and Booker's bestie, and this is how Booker is most of the time. However, the owner came in because Booker started presenting due to episodes, okay, and lethargy. And I really want you to see this video. For some reason, it's not loading, so just bear with me while you see the rest of my screen here. And I show you this video. You can see all of my stuff now. Let's see, desktop. This is so important. Here we go. Bear with me for a minute while you see the rest of all my stuff. And we go to where I know this video exists. Here we go. All right. Here are the episodes. So these are the episodes that Booker's mom was seeing at home. And this is an older video, so I'm sorry about the clarity. We're going to watch this. It's about a minute long. And he would have these episodes 4 to 5 times a day. All right. So now that we've seen that, let's go back to where that was supposed to be. Here. All right. Here we go. All right. So now that video just doesn't like me, does it? I want to know in the chat, do we think this is a seizure or a stroke? Ooh. 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 All right. All right. One B. A couple more B's. Okay, okay. All right. So I'm not going to tell you the answer just yet because we're going to figure out this cape. Stroke something. Okay, okay. I like how you guys are thinking this through. So what are we going to do to figure this out? Okay. We're having something that is clearly affecting the neurological system. And the question is, the big question we have is this a stroke or is this a seizure? So how do we figure it out, right? Well, here's a way to kind of think things through. And here's some of the different differentials that I have on the list. We could do radiographs. We could find out if atherosclerosis is present. Lead toxicosis can absolutely cause seizures if this was a seizure. Is there any evidence of neoplasia, which in the body, which may allow us to theorize that it could be in the brain as well? Chronic severe chlamydiosis can have neurologic clinical presentations. We talked about lead toxicosis, but in chronic cases, you can have elevations in uric acid. And so ultimately, the CBC in chemistry could tell you a little bit more about that. Neoplasia, what if there's something like a leukemic picture on your CBC? That's something that we could determine from that. Avian bornovirus serology, avian bornovirus PCR and antiganglioside antibody serology are two tests that can be done where in the face of clinical signs and two positive tests, you can have a very high likelihood of lymphoplasmacytic ganglionuritis or PDD. And then, of course, we have a diagnosis of exclusion, epilepsy. So in this case, we saw the first video of Booker, and we saw that most of the time he's pretty darn stable. So it was very reasonable to go down at least the course of getting a minimum database. So obtaining radiographs and getting a CBC chem were the first two things that we did. There we go. Sorry. Okay. So we took some rads. And one of the things that we want to recognize is that we look at the heart, right? Heart's here. And let's see if I can actually draw on this. Heck yeah. Heck yeah. All right. So we've got the heart here. It doesn't appreciate, we can't appreciate that it's like super, super enlarged or anything like that. We see clear, even air sac spaces from the pulmonary region to the caudal thoracic air sac down to the abdominal air sac. This bird has a bunch of grit in its ventriculus. You can see that all sprinkled here, okay? The ventriculus is kind of in this region, roughly. And then, of course, you can see it here as well, right? All that grit. It's kind of nice because we have this like contrast study without any extra work. That's of no concern to us. This bird doesn't necessarily need grit, but it's not going to cause its clinical signs, and it's not consistent with metal, so we can move on past that finding. What I do want to point out is visibility of this bird's descending aorta. And so let's make this a different color for Kixies. And then get the little pen. Yeah. Check this bad boy. Check out this vessel. And then you've got your aorta coming all the way down here. Now this bird's like 520 grams-ish. There's your descending aorta. Here's one of your pulmonary vessels. Here's your brachiocephalic trunk. There's no way that we should see those vessels as well as we do in a normal bird. And I want to point this out on the VD as well. Here's the brachiocephalic trunk on this side. Here's the other one on this side. This little dot is your end-on aorta. And, oh, actually, you know what? This is really a bad. Let's do this. I think your brachycephalic trunks are actually up higher because you can see this and this coming off it. Ultimately, this bird has awful atherosclerosis. There's only one understood reason why the soft tissue opacity of a blood vessel in a bird would become more soft tissue opaque, and that is thickening of the vessel walls, and ultimately that would be secondary to atherosclerosis. And so what happened was when people were first studying this disease is they were seeing this, and the birds were dying from, you know, whatever it was, from their stroke or congestive heart failure or a combination of the two. And they were, you know, doing histopath after on necropsy and finding that, hey, you know what? There's athero here. And then they started to say, okay, well, look at this. When we see an increased soft tissue opacity, we're finding that there's atherosclerosis histologically, and we put 2 and 2 together. So now we can sit here with confidence and say, all right, well, we're not going to go and biopsy this organ. And we know that technically atherosclerosis is a histopathologic diagnosis, but based on the combination of all of our knowledge, we can call this at this state. Now, in really severe cases, you'll have mineralization of the wall, and those are really easy to catch. But this is something that was very, very important in Booker's case. We also know that this kiddo has arthritis. So I want you to check out these stifles and check this bad boy out here. See how you've got this kind of this mineralization, you've got this here. The articular surfaces are poorly defined and maybe even slightly irregular. He has arthritis. And so you have 2 clinically relevant findings in this case. All right, little pen thing was cool. So, oh, but it keeps everything. Hang tight. All right. How do I make that go away? Yeah. All right. Ooh, cool. All right. I've learned something new with y'all. So, with this all being said, what can we say? Well, we know from our radiographs that atherosclerosis is definitely present, but is there anything else we need to learn? And we're going to look at our blood work next. So this is what our blood work showed us. We've got a very mild leukocytosis, but otherwise relatively normal differential. The cell morphology was also normal. Uric acid was normal, bile acids normal. AST was high, but so was CK. So let's talk about this. Because when you look at AST in a vacuum, right, you may be thinking, oh my gosh, this bird has a hepatopathy. But AST elevates for 2 reasons, due to hepatopathies or liver issues and muscle issues, right? So like if you're really stressed out, your AST can go up because your CK goes up, right? CK elevates due to stress and muscle damage. So if your AST is outside of the normal range and it's higher than the CK, it is reasonable to have concerns about a hepatopathy being present, okay? If, however, your CK is higher than your AST, even if your AST is outside of the range, it's more associated with stress. So in this case, I don't care about this AST at all because it's highly unlikely that this bird has a hepatopathy associated with its clinical picture. The other thing we're going to look at is the albumin. The albumin is low. Now this is a trick because on a standard chemistry panel, the albumin measurement is always inaccurate. You can never, ever, 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 ever use it clinically to interpret anything. The reason is that albumin is calculated via the bromesqual green method. This is a way to essentially like heat it up, and then over a period of time, you have this reaction happen, and then at a very specific period of time, you make a measurement. And what that measurement is supposed to tell you is where albumin is. But the reality is that only works in humans, dogs, and cats. Our small mammals, it kind of works in sometimes, but it can be erroneous in like some rabbits and guinea pigs. In birds, it either significantly underbinds during the reaction or significantly overbinds. And so because that initial reaction is unreliable, our reading at that time period is going to be unreliable, right? So the only way to really know what the albumin is doing is to do a protein electrophoresis. So you're going to see albumin in all different chemistries. And then you'll also see globulin as well. Globulin is always a calculated, except for in NADPH, but globulin is a calculated component. It's total protein minus albumin gives you globulin. So if albumin is wrong, your globulin is wrong, right? So I hope that that also is seared into your brain. So where are we at with our friend? What can we say? Atherosclerosis is present. We don't have evidence of lead toxicosis. We don't have evidence of neoplasia. We don't have evidence of an infectious process, so it's unlikely that chlamydia is present. It would still be reasonable to do these tests for PCR and for ABV and AG and to do the ABV PCR and the AGA serology. And of course, you know, we have to keep this here in the back of our mind. But based on everything we've learned today, it's very reasonable to start a treatment plan for atherosclerosis and arthritis. So it turns out that the video I showed you was actually this bird having multiple strokes. It was literally unable to get enough oxygenated blood to its brain on a regular basis throughout the day. And so it would just have those episodes that I showed you in that video. What was really cool is that when we started our treatment plan with enalapril and isoxaprine, the episodes stopped. They stopped completely. And it was when they started up again that we adjusted treatment again. And ultimately, Booker did well for about 6 months and then passed away from a stroke event. But it was like he didn't have any for a very long time, and then he had a big one. But this is a very, 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 very common disease process in all birds. Older birds, they have atherosclerosis. So when you see these guys coming in and they're older and they're neurologically inappropriate, always have cardiovascular disease on your list. It's not to say it's going to be that every time, but have it on your differential list and rule it in or rule it out. If you can do an echo, you can look at contractility, you can look for volume overload, like ascites or pericardial effusion. Although in this case, volume overload would be less likely because we didn't see that the heart was big on radiographs. You follow up appropriately, and then, you know, older females with a history of reproduction, obesity, high-fat diets, they're overrepresented. They're going to get atherosclerosis at a younger age. African grays, yellow-naped Amazons, macaws, and cockatiels are your 4 most common species that you're going to see this in, although it can happen in any single species, including birds of prey. All of these patients will likely go into CHF at some point. Just like in dogs and cats, you're just buying time. When you think about like atherosclerosis in people, is there any effectiveness of statins? Not really. There's some very, very recent literature that may be supporting a different thought process, but it's pretty early at the moment. There's no cure. And if you give furosemide, when you give it injectably, of course, you get 100% bioavailability. But in birds, across the board in all species, the bioavailability of furosemide is awful. And therefore, you must double or triple the dose when you give it orally. So let's say you give 2 mg per kg IM, and you've got good control over your patient and heart failure with that. You want to go somewhere around like, I don't know, 6, 7 mg per kg PO. So that's how you double and triple it. And then we have arthritis. It's not his main problem, but it's there. We should do something about it. Arthritis management in birds is always a combination of pain management and environmental adjustments. Unimodal, like one medication, bimodal, trimodal, it all depends, and you really tailor these things to the individual patient. All right, so you guys are doing great. One thing is, in addition to all the Harrison's books, this is also another excellent resource. And if you're really interested in cardiovascular disease, not only is there a great topic, a great chapter in the this current therapies book, but then there's also a great VCNA article about therapeutic options. I want to thank you guys so much for being so attentive, being wonderful. I hope you gained a lot from this. It seems like you all have a really wonderful foundational knowledge already just from the answers to the questions. And I'm open to taking questions. So I'm going to stop sharing my screen and yeah.
Well, thank you, Dr. Murphy. That was a fantastic presentation. We had
Oh,
a ton of questions in the chat, and I
okay, awesome.
recorded all of them, so I will email them to you.
Beautiful.
And then Dr. Murphy, if you wouldn't mind actually putting your email in the chat, I know it was on your last
Oh,
slide.
yeah.
That way they have access to that if you guys have any questions you want to follow up on. And then we have a very special giveaway. This is from MDS Vet. They are donating medical loops with a headlamp, and this is worth about $500. And the medical loops are going to go to Ashley. I put your name in the chat because I really don't want to butcher your last name. So I'll be sending you an email. So thank you to MDS Vet for sponsoring that. And we had a great time with you all. There is one poll I did want to launch for a last minute chance to participate and win a gift card. So let me go ahead and launch 2 more poll questions for you guys, just to make sure everyone has a chance to participate.
And I'm going to answer one question that I see that I actually think is a really good one I want to do while you guys are doing the poll. Sarah asked if there's any tips for exam priorities in an emergency with an unstable patient. And there are 2 things that I want to know right off the bat. When was it like, okay, so what is their muscle condition and what is their respiration? Because you get that unstable patient, and if they're having any issues, you can put them in oxygen, you feel that muscle mass, maybe you feel their belly really quick, like, is it distended or not? And then you can go talk to the owner and you can say, hey, listen, JoJo's really not doing good. And I can tell you that whatever is going on has been going on for either a long time because there's no muscle mass, or there is, or hey, I think this may have just happened because there's good muscle mass. It can guide your conversation into saying, hey, we have him in oxygen right now, but these are the things that we need to do to help him. And then you can deliver a general prognosis. When you have birds that are this sick and their disease has been slow and chronic, I worry very much about how successful we're going to be because they may not have the ability to respond to the medications that we can give them. On the opposite side, maybe you have a bird who's been boarding somewhere or being cared by somebody. This is so common. They come in, they're physically perfect. They look dehydrated as heck. You go to the owner goes, I just came home and they looked like this. And you say, could they have not had enough food and water? And a lot of people go, oh my God, you're right. I didn't see any water in the bowl. In which case, boom, you kind of have an idea of, is there anything you could have gotten into in the last 24 to 48 hours? Or, just from those 2 things, how's the respiration? What's your muscle mass like, right? And then, if you can sneak that coelomic contour in, that's really good as well. Otherwise, I think that's all I do. And then I go, let's see where he's at. Let's see how he's looking and let's go from there. What you can do is if they're in oxygen, if they're having issues and you pull them out for a moment, like they stabilize for a moment, you can pull them out. You can maybe get a quick listen to them. Are you in heart failure, right? Do I hear crackles and things like that? That can be like, all right, I think I hear crackles here. Let's get some furosemide because if we do nothing, nothing good is gonna happen. But I hope that that helped answer your question. I find that those little things make a difference for me. And again, you make a broad framework and then you make it small. Don't try and make it small right away. So anyway, I look forward to seeing all your questions, and what I'll do is I'll write a little answer to each of them, and we can email it to all the participants if that's cool, Kaitlyn.
Sounds good. Okay, well, thank you everyone for joining us tonight. It was really awesome having you all here, and thank you to Dr. Murphy. It was great having your expertise.
Thank you guys, and I look forward to our next meeting. Bye.